The goal of treating addiction is to achieve a sustained recovery, to create a new life in which it is easier and more rewarding not to return to addiction-related behaviors. But the reality is that 70 to 90% of people in recovery experience at least one setback before achieving sustained abstinence. That said, relapse shouldn't be considered a necessary part of recovery, nor should it be used as an excuse for relapsing. However, people who relapse gain nothing by beating themselves up about it. Frustrated family and friends won't accomplish anything by criticizing either. The most productive response that will get the individual back on the road to recovery in the shortest amount of time is to use the setback as a learning experience. A slip is an indication that some aspects of the current treatment plan aren't working or are difficult for the individual to adhere to. The potential for relapse and the fact that addiction is never cured, only managed, is why addiction is commonly called a chronic disease. In fact, relapse rates for addictive diseases which involve the brain are similar to rates for chronic diseases that affect other parts of the body. When someone with a chronic condition like diabetes, hypertension, or asthma suffers a relapse, the typical response is to explore the reasons for the setback, reassess treatment, and make adjustments as needed. Experts encourage a similarly constructive response toward addiction relapse. That entails responding immediately, dealing with negative feelings surrounding the setback, determining what went wrong, and making necessary adjustments to prevent a recurrence.